Okay, so this is part 3 of the Introduction to Anatomy and Physiology lecture. Talk about homeostasis. So homeostasis is the body's ability and need to maintain a stable internal environment. And we really spend our entire lives trying to maintain homeostasis. We don't always do a good job of it. So examples, we like to keep our bodies at 36 degrees or 37 degrees Celsius. Blood pH 7.4. Other examples, we maintain homeostasis through a process called negative feedback. And negative feedback is designed to bring us back to homeostasis. For example, when it's hot outside and our body temperature starts to rise, we sweat, okay? And that sweating takes heat away from our body, and then we reduce our body temperature. When it's cold outside, we shiver. And when we shiver, that helps to create heat inside of us through our muscle contractions and, well, really through the use of energy for our muscle contractions. And that heat brings our body temperature back up. We also have positive feedback, but positive feedback really brings us away from homeostasis, but for a good reason. One of those examples would be having a fever. So when we're sick, we have an infection, and our body causes us to have a fever, raises our body temperature to help slow down the reproduction of whatever it is that's making us sick. Blood clotting, that's another one. Normally, we would not want to clot our blood, but if we have a cut, we want to clot our blood. So that's positive feedback because it's bringing us away from homeostasis. Another one is contractions during childbirth. Those contractions are meant to help us, or help women get a baby out of their bodies. So this is an example from your book showing how a thermostat in a home is kind of like the thermostat that's in your hypothalamus. So when its temperature is too high, we get receptors in the home, which is in the thermostat, and that turns the heat off. Okay, and maybe the air conditioning turns on. What happens is the temperature returns back to the homeostatic set point. When the temperature is too low, the heat comes on and the AC goes off. The same thing's happening over here with your body. Your hypothalamus senses that it's gets a signal that, hey, it's too hot, and it will cause our blood vessels to dilate and our sweat glands to start producing sweat, and that will reduce the body temperature. Okay, let's talk about disease. Disease is any breakdown or detraction from homeostasis. So, I guess not hypothetically, you could cause any single problem in your body and call it a disease. So, a cold causing a fever, that's that the cold is a disease. Low blood sugar, that's a disease from diabetes. So anything that causes us to move away from the homeostatic set point could be a disease. Opening up the body, so really a hangnail then could be considered a disease because that's not how you normally are. You normally don't have an opening to the outside of the body like that. Okay. Disease effects. Disease can be local, so they only affect a limited area. Okay, sprained ankle would be an example of a local disease. That hangnail is a local disease. Or they could be systemic. So the disease is all throughout a system or the body. Acute diseases are usually come on suddenly, or they do come on suddenly. Okay, they don't always last very long, but that's not always true. And they're usually severe. Once again, not always true. Chronic diseases come on more slowly and usually last for a long time. Epidemiological terms: endemic means a disease, and these describe how a disease exists in our environment. Endemic diseases are always found within an area. Okay, so always found within a geographical area. For example, rabies is endemic to Cape Cod. It's always there. The animals always have it there. Okay. Epidemic is a breakout of a disease in an area. So things become an epidemic when you have this sudden increase in the number of cases in an area. And usually epidemics last for a period of time and then they're no longer an epidemic. A good example would be what happened with Ebola recently in Africa. It was an epidemic thing. It broke out, but now it has subsided. And it's not always there like that, which would make it endemic. A pandemic is a disease that's found all throughout the world. So it's a disease found all throughout the world. All right, the doctor talk. I say doctor talk, but it's really just medical terminology. So signs are things that you can observe. Okay, they're things that the person looking at the patient can see for themselves. This could be an x-ray, but it could also just be flushed skin. Okay, but they're things you can observe. Symptoms are things the patient tells you. So the patient says, I've been vomiting for 3 days. Well, that's a symptom because you have not observed them vomiting for 3 days. They could say, my stomach hurts. That's a symptom because you can't actually tell if their stomach hurts. Maybe you see them holding their stomach and guarding it, but doesn't mean that it's a sign. History, medical field, when we talk about history, we're really talking about their medical history, but it could also be their dietary history that you would want to take. So find out what they did recently, what they ate. Maybe that would help to understand their exercise history. That will help to understand what's going on with them. A diagnosis is when the medical professional tells you what's wrong with you. So they tell you this is what you have or this is what happened to your body. Prognosis is what's going to happen. So this sprained ankle will last for 6 weeks and it'll be swollen for 6 weeks and the pain will subside after 4 weeks. Okay, prescription is what the medical professional tells you to do to get better. Could be a medicine, okay, maybe take Advil for the swelling, for the sprained ankle. It could also be physical therapy, would fall under prescription. It's when the doctor or the nurse or whoever it is tells you this is what you're going to do to feel better.